All right.
Yep, I did my time.
Okay, I have 6 o'clock and I'm going to call the Pine Valley Subcommittee meeting to order. Monday, today is December 15th at 6 p.m. Can we have roll call, please?
Yes.
Miller,
Here.
Kramer,
Here.
Manning,
Here.
Cooey,
Here.
Richardson,
Here.
Hendrickson. And then you're new, Thompson. Here. And I think we have everyone.
Thank you. I need approval of the agenda and verification on the posting. Our agenda tonight is 9. So if I could have a motion for the agenda first.
Second.
Okay, any questions or additions or disagreements with that? If not, the agenda is approved. Verification of posting.
It was posted in time.
Okay. Number 4, approval of minutes of the October 20th, 25 Pine Valley Subcommittee meeting. Are there any additions, corrections, deletions, or questions on that? Hearing none, I will declare those minutes approved as they are written. Number
Excuse me.
5, I'm sorry,
Am I on the wrong? Yes, I am.
trust me,
Well-
I'm right.
Yeah, I know. But just, I wanted to go back, just so you know, next time for our next meeting, I would like to have a closed session. It got missed.
We'll have to put it on the next agenda.
Yeah, because I requested it, and somehow it didn't get on,
Okay,
so,
all right.
thanks.
We're down to public comment. Colleen's already made hers.
I have a public comment.
Sure, go ahead. Your name, please?
My name is Deborah Muller, and I was a CNA at Pine Valley for 23 years. And on October 24th, 2025, in a meeting with Tricia Clements and attorney Mike Wendell, I was told I was to retire early by October 27th, 2025 at noon, or I would receive no money for sick days or vacation not taken. This happened because I reported to state that when I came into work at 8 p.m. on September 7th, 2025, there was a 16-year-old by herself on the 300 hallway. This is not legal. Yes, there was a nurse, but they don't have enough time to help. Also, under 18 cannot use easy stand lifts by themselves. The morning of September 7th, 2025, there was one CNA for 1.5 hours by herself. And the same thing happened Monday morning, September 8th, 2025. I called the state, left a message for Julie Grant, and also called County Board Chair Dave Turks. State and federal surveyors came, and I was texted to stay over on October 21st, 2025 by the scheduler to talk with the surveyor. I was sitting by the fireplace across from the community room. Administrator Brittany came and told me he would be there at 8. Then HR Angela comes walking by, humming and singing several times. I was interviewed by the inspector right out where everybody could see us. This is supposed to be anonymous. Before the meeting, I was helping morning CNA with a resident in 302, and she was very angry and upset about having to use the easy stand. So I lifted her in a wheelchair and she did fine. That resident has been very sick before that day and was doing tremendously better. I was already able to comfort her because she knew me. The resident also had fallen out of the easy stand twice. Luckily, she was over the toilet or she would have fallen on the floor. At that point, she should have been to assist with easy stand. Later on Tuesday afternoon, October 21st, 2025, at 5:15 p.m., I was called by Brittany with Angela Walls and Jesse Town in room that I was suspended from work for an investigation on how I transferred the resident 302. The only person in the room was the other CNA. My question to you is, was I retaliated against because of wrongdoing of reporting to state? I'm writing to you all before I decide to hire an attorney. I do believe we as taxpayers vote you in for a reason. I did record the meeting between Tricia, Mike, and myself, and Tricia's last words is, "Don't let this out to the public." I'm also protected by the Fair Labor Standards Act, Title VII of Civil Rights Act of 1964, and OSHA with retaliation. I'm doing this because the residents are our customers and they need to be treated with dignity and respect, and they are also paying our wages. And I also got to have a face-to-face with Tony Kurtz today, the representative in the 41 district, and his office is always getting this very same letter. And he said he would be looking forward to reading it. So that's all I have to say.
Thank you, Deb. Anybody else with public comment? Okay, we are gonna move on to number 6, administrator census.
As you can see in the report, there's several pages that kind of goes over our census. We maintain between 69 and 70 patients, and then on the ALF, we maintain the 16 across several months. And it shows for November and October, the dates that were missed. So our census is pretty stable. For the most part, nothing really changed, just really good hospital resources. We've had a lot of respite stays. So those are kind of your short term, less than 30 days. Kind of where our census was.
Any questions for Brittany? Moving to number 7. Pine Valley financials. Overall financial standing, October through November.
Okay, I will go ahead and share my screen. For those that don't know me, I am Leanna Pick, the finance director for the county. I know some of you, but not maybe all of you. I've done a couple of these presentations now, for a couple of the other departments and things, so I thought I would share what I am seeing here. Okay, so in your packet, so you've got a few of the different reports in your packet. So my intention is to kind of walk you through where we're at, kind of the different pieces, how they fit together in these various reports. So the first one I've given you is the balance sheet. There's a lot that goes into this particular one, so I'll kind of start with what it actually represents. So the top section, your assets, that's what you own. Your liabilities is what you owe. And then the equity is what you have remaining after you've taken care of both of those pieces. In Tyler, there's a line called claim on cash. You can see cash shows up as 0 because it used to be in the AS400 system that we would run all cash receipts through a cash line. In Tyler, it actually operates on a claim on cash. This line is essentially your checkbook. It is going to tell you what you have in terms of deposits, so money coming in, and what you have going out in terms of accounts payable, payroll, all of those things. And there's a snippet of it in your thing about page 3 there. It looks like this. So you can see we started January with a pretty healthy cash balance there, $4.8 million. We brought in, we take it out. So 4.8 is your starting. That includes cash that was left over in the fund plus new deposits that came in for property taxes. So that's what's making up that 4.8 million. The stuff you see for February through November there, those are various journal entries that are done to book various things like interest, anything that's not flowing through the payables. So when we first started with Tyler, we were also first starting with Matrix. So there were some hiccups in the beginning of the year with payroll. So that's why you see kind of the blanks there in January, February, March payroll, because it was flowing mainly through those journal entries. And that's why those numbers are so large there in that first column that kind of says GL journal entry there. right underneath the 4.8 million. You'll see 453,000, 706,000, 370. So it's been dwindling down as we've been working through Tyler and how we can get those things to flow better and actually use the system the way that it's supposed to be used. Instead of, you don't want to be writing journal entries for everything. It's basically an over the top of your accounting cycle. It's coming in and saying, I need to correct something, or I need to add something that doesn't go through accounts payable or doesn't go through payroll. So that's what that column is. Obviously, deposits is pretty self-explanatory. The one that's not there is January, because our cutoff in Tyler was February 11th. So before that, everything was being booked still through the AS 400. So I've had to go back and look those up. We'll see that exact number, I think, here in a little bit of what that is. It was like 1.1 million with the property tax deposits that came in, which were about 750,000. So the rest would have been normal deposits coming in from AR. All right, next one over is AP. So again, sending all those payroll payments and stuff through AP, those first couple months there look kind of hefty. We also had one that went in and went out again, so we made a correction, so you can see that in the column next to there. So that's money going out. Then the next one, payroll, that too is money going out. We had a few minor corrections in there. And then you get to your ending cash balance, 4.4 million or so. And that's including some that's been spent already for December, but mostly what I'm talking about is year to date through November. So if we take that 330 out of there, you're 4.7 million or so end of November for cash. All right, so we can return back to our balance sheet. The liability section, that moves quite a bit. It's constantly a moving thing with the payables going in and out. So not a whole lot to discuss in that section. And then the equity, what you see there, the first line is your fund balance as of the beginning of the year. So the second printout I gave you was called Fund Balance Report. And you can see that 4.28 million to start the year. That was your fund balance, your equity in Pine Valley. Then what happens next is what's happening on our income statement, which is the other financial part. That's where all of your activity happens. So that's where you're booking your revenues, which are different than your cash receipts, related but not the same. And that's also where you're going to see your expenses going out. So all of your operating expenses are contained in this other report here called income statement. So the first line, you see total revenue on your balance sheet, 11.4 million for year to date. And then you saw total expenses of 10.9 million, leaving a surplus of 446,000. All right, so the income statement is rather large. There are a lot of accounts at Pine Valley because of all the reporting we have to do. We have to break those down by various departments as well as what is it. So that's why you see so many lines on there, but a little light reading material for you if you want to kind of go through each of the lines and see if you see anything that stands out to you or have questions on. You can let myself or Brittany know and I can get back to you on that. But here's that 11.4 million in revenue year to date. So it kind of shows you what you've had each month. So for October, we had 1.1 million in total revenue that was booked. And then in November, we've added another 867,000. So that got us to 10.6 million. And then up above that, you'll see your 754,000, which was your property taxes that are assigned or allotted to Pine Valley. So that's how we get to the 11.4 in revenue. And then we kind of work our way down. I added, let's see, no, not on this one. Sorry, misspoke. So a lot of your expenses for Pine Valley will fall in a line called, if it's not salary and it's not benefits related or per diem, it falls into this line here called bills, no line detail in Tyler. And that's again, because we're not going to have all of the account structure that is within the matrix system. but the two tie to each other. So I've spent the last couple of weeks making sure that whatever is in Tyler is in Matrix, and what's in Matrix is in Tyler, and the systems are balanced to each other. Okay? All right. So I just wanted to point that out. So if you're looking for like utilities, you're not gonna see it. It's buried in that bills no line detail. You know, if you're looking for medical supplies, same thing, buried within there. What I'll do, once I get all the systems tied out, I'll bring to you the actual matrix financials that will show you the breakout of all those individual things, not the bills no line detail. Does that make sense? Okay. So if we go all the way to the bottom of this really, really long financial statement, there's a couple lines I'm gonna highlight here. They are highlighted on the screen in yellow. These are for the kind of notes, bonds payable. I'm not sure if everybody's got kind of a different name for them, but they were basically loans that were taken out and the dates showing that are paid off a little each year through your debt service. That's what this represents. And a portion of it is principal and a portion, the smaller ones are the interest associated with that. So just wanted to point that out. And then we come down just a little bit further, we'll see over here, the very end of the expenses, we got that 11.3 million. So if we go back to our balance sheet, it's not quite there because again, I told you we had a little extra that was in there from December that we haven't published yet. So that's how we're getting to these little red box on the balance sheet that represents your revenue that you're gonna add to your equity and the expenses you're gonna take out. And there's the 446,000, which if we were to end today and close the books today, that's how much would be added to your fund balance. So we are in a positive setting for Pine Valley. So we're not negative. And I don't know, there was some inklings about that, but we're not negative. We have over $4 million in cash. Now, some of that, it has to be reserved because you need to have 3 months or so on hand in case something catastrophic happens, okay? So we've got that covered. And your operating expenses come to anywhere from 800,000 to $1 million per month. So that's what you can figure on for Pine Valley. And that's including all of your salaries, all of your bills, no line details, everything that it takes to operate that, okay?
And we just billed for the month of November, so all that closes out in the 15th. So we have to have all the claims posted in Medicare, Medicaid by the 15th. And I think Haley did them yesterday or on Friday to close out those. So those will be coming in as a revenue as well.
So what's the number on that fund balance that we want to keep at?
Well, if you're looking at 3 months of expenses and you're running about $1 million a month in expenses, I'd say $3 million, yeah.
That number there you want to know.
Yeah.
Right? Because if you start creeping into that fund balance, then that's going to be a problem. And it's pretty healthy right now, I would say.
Yeah.
But
What exactly is our tax levy now every year for Pine Valley?
I'm gonna show you that in just a minute. When I get to the year over year, we'll get to see that and how that has changed here. Go ahead.
So you're saying we're ending in a positive balance this year now, if I understood it correctly, when we did our audit stuff from last year, that the county had to give $1 million to make Pine Valley whole, as far as, because it was a
2024, there was a negative,
Yeah,
so
there
we
was a
will see
negative of
that
$1 million, so we're seeing that we're actually in a positive of 440.
as of, yeah, for this year, right now, that's how we're trending. And that's again, why I'm doing that tie out to make sure
Yeah.
that we're not missing anything in
So it's
Tyler
looking
or.
better than it was.
Yeah, it absolutely is. And we can see that now. So we've got that big income statement. I got this one called income statement year over year. And I did this for some of the other, funds as well. So you can kind of see where you were in 2020 and where you are today. So you can see kind of how that tax levy has obviously come down quite a bit year over year, 2024 even. You're looking at that being, 400,000 to 500,000 short of what it was the previous year. So that might have had something to do with what we're gonna see at the bottom of the statement here. And you can see I highlighted in green, the big swing in the revenue. That's like the lowest one of any of the years here that we're particularly looking at. So that caught my eye right away that the revenue was down. Some of it attributed obviously to less tax levy coming in, which things being tight, we know that we want to get to being more self-sustainable and not needing as much tax levy. I know that's what they've been trying to move towards. And then you can see our 11.4 where we are now. That's pretty healthy bit. Obviously here too, you're, what, 800,000 or so more just in your revenue line there from Pine Valley this year over 2024. And then if we go all the way down again to the bottom of this one, we're gonna see that same thing. We're gonna see that gap in that revenue line there in 2024. But we're also gonna see a spike in expenses. Those expenses are higher than, they have been, are this year, and they're higher than they were in 2020, 2021, 2022. So there was a spike in there. I started looking into some of it. I did find that there was in that year 117,000 that related to retiree sick leave, health insurance, conversion being paid out. But then too is gonna leave you still with a $900,000 hole or so, that things were just costing more. And I started going through one of them. Another big one was this bond payable, which does seem to increase a little bit every single year. So from 2023 to 2024, it actually had a big spike in that. So you can see that there. This one went up a little bit, and then the interest went down a little. Which you'd expect. You're paying off more of your principal, interest going down. So you can see we're sitting okay so far. I get a little nervous because again, we've got the rest of this month to go before we can say we're done, but depending on what revenues look like for December, then we'll know as soon as that's in. So right now I don't see those in matrix until the period is closed. So they all reside down in the AR subledger. And then when Brittany closes out the period, then it all flows up to the general ledger and matrix where I can see it. All right, so any questions on that one? And then I did have just a chart to kind of show you again that year over year, that revenue line, again, with the property taxes and stuff in it, but the big dip in revenue, the upside down there in 2024. And that's what we're kind of cautioning against, just to make sure we're not repeating that in 2025. And this one, if I took that out of there, because that's December and we haven't looked at December yet. So there's your 446,000. So all I've got in here for December right now is expenses related to some payroll and some payables. I don't have any top line revenue in there yet for December of 2025. So that's why you're seeing the way that you are. But as of the end of November, you had 440,000 of surplus year to date for Pine Valley.
We usually bring in about 200,000 a month. Usually billing over expenses, as long as the census is like good.
Yeah, as long as you've kept the census up, so that's what made it different. Because 24, that census is down for several months, and he got into a big deficit right away, if I remember right.
Okay. Yeah, I don't have that one month by month, but it's definitely something that happened in 2024, appears to be somewhat isolated to that, not seeing it repeating this year. Again, we're at the very end. We've got just this 1 month left to go. You're probably gonna see, we got 300,000 in there now. You'll see another 700,000 of expenses. And then we'll just hope that we have that top line revenue at about 1.2 or so.
How much of that carries over into the next month on the revenue?
Yep, what will happen? So that's what this does. So as of January 1, these will go back to 0. And then that 400, whatever is left as either surplus or deficit, will move itself up against this line here for equity. Essentially, your fund balance that we saw here will change. It will go to, well, if it was going to end today, or end of November, it would have ended at 4.7.
But if there was payments that were late, so you get payments in January, what do you do with those
Yep.
that are from December?
Yeah, we actually have a plan, a process in place for our department, how we're going to handle those. So we're going to assume anything that comes in the first 2 weeks of January is gonna be related to 2025. And we will do an entry to move those expenses back in Tyler. And then anything after January 14th, which is our payable cutoff there, we will look for Brittany and them to tell us what is still related to 2025. And until the audit happens and they ask for stuff, we can continue to do that. But once an audit starts, which I know yours starts before the one for the county, we will not be able to do that. But the assumption is first 2 weeks of January, get as much as you can in. You know, if you have to reach out to vendors to get invoices, let's do that too, so that we can get as much as possible in 2025 without crossing into that 2026 budget area.
That's the same as like, if they're gonna pay, you know what I mean, and it's not due until the 2nd of January, let's say, for service, whatever, I don't know, how the cycle is, but you're always gonna have rollover 1 year.
And you do it on a monthly basis, but the only time it really matters is at year end. You have to make sure that you have that correct. You have to make sure that if there's any days that cross over for payroll, that you book that back in through accrual, that gets in the right period as well, so. We have that, we're working on that, we've come up with a plan and that will be rolled
You
out.
gotta pick a point in time, I mean, it's just
Yeah.
whatever this.
We do, it's never gonna be perfect, and then that's where we're gonna rely on our department heads to tell us, you know, after January 15th, if something comes in that you really have to get back into 2025, let us know, and we can do that. Any other,
This is really good, thank you.
you're welcome.
Because it's much cleaner. At least for me, this makes perfect sense to me, so it's really easier. Thank you.
Because this is what we are moving to. I mean, this is why we bought a Tyler system, we use your system, and we just have to make sure they balance and everything, so. Good.
Thank you so much.
You're welcome. Any other questions before I head out? All right, thank you.
Okay, moving on to number 8, administrators reports. Need an update on new food provider.
We got all kinds of stuff that's happening. We're really excited. So average daily census was, we talked about 69, 16 for the ALF, and this is, you know, for November. Skilled Medicare census was 7, admissions month to date was 7, and discharges month to date was 7. And like I discussed before, you know, it results in like respite stays. So the short term, that's why we had a lot of in and outs, you know, around the holidays, residents, families want to bring them in or, you know, take them out. So we accommodated those. Like regulatory and survey activity, like I stated, last survey was completed on 10/21/2025 on the SNF side and 10/28/2025 on the ALF. On the SNF, they had complaints regarding staffing and aerosols causing pneumonia, noting that there was no concerns and no citations that were issued. ALF biannual survey was citation free and no concerns were noted. Thought staff were well educated and the building was clean and residents were extremely well cared for and happy. For quality measure and QAPI, so we talk about QAPI quite a bit. Pat's been to pretty much everyone since I started. So she gets to see kind of like our initiatives, what kind of things we're working on. So a lot of it's like our admission documents, making sure those are timely and put into the system appropriately. We work on a fall preventative fall reduction program. So we've actually brought therapy in to really take a look at residents who have frequent falls, get those preventative measures. We had therapy come in for an all-staff meeting about why they put people at a specific transfer, and why we need to follow those. Pressure injury prevention, we just brought out FORA, which is a wound care physician. And then they started December 1st, and it's been fantastic. So it's an actual physician that comes in. He's a general surgeon and a vascular fellow currently. So he's able to do a lot of things bedside. Comfort, making sure residents, you know, remain in their home. They're able to debride wounds. They're able to do all those fun things. And then we brought in Gentel. Gentel is like a Part B wound care supplier. So essentially our wound care costs are going to go down significantly. So whereas we pay thousands of dollars a month for wound care, we will pay essentially about $200 a month. So the goal was to kind of lessen that and then let them utilize their Part B benefits where they can be billed on their Part B and we don't absorb those costs and then get the appropriate wound care, like the specialized wound care, certain wound care that we can't obtain or it's really, really expensive, it becomes a facility expense. So we're trying to lessen the expenses that we have. Readmission, reinduction, so there's just certain things that like we can't avoid, whether it's a CPOD, CPOD, exasperation or COPD, sorry. We had our medical director kind of come and do some education with the nurses on managing symptoms in the building prior to sending out, because that's a hit on our quality of care, like our stars, things like that. So we're really trying to prevent, outgoing to ERs as much as possible. And if anybody's seen our ambulance rides, it's been excessive. So fire safety, we just did a tire skills fair for the staff where they actually got to play with a fire extinguisher and utilize it so they know when we say pull, aim, squeeze, and sweep, they can do it safely. We are utilizing quite a bit of agency, but we just approved new wages for LPNs, RNs, and all the other ones. And we have quite a bit of RAs coming in that we'll be sending off to school for CNA class. So we're super excited about that. Let's see here. We are revamping our orientation process for the beginning of the year. It is going to be practically a whole day thing where they get to spend time with each department an appropriate amount of time to be fully oriented into the building. Myself, Jesse, and all the department heads are working together to create that orientation process. So we're really excited about that. Just as a reminder, we do have a holiday tribute tree out at the facility for residents who are looking for something. Pat was lovely enough to put all that together for us. So that's out at the front, right in front of, right in the entrance. It's got little pieces of paper on there. So if you're interested, please come out. Transition to a new food provider. It used to be known as Reinhardt. It's called Performance Food Group. So far, what I've heard is it's better food overall. The taste is better, and we're going to save about $20,000 a month or annually. So we're really excited about that. We just got access to their menu program, things like that. So really excited about that. We actually had a huge meeting with the residents in regards to food, try to better the quality and make them extremely happy. And then we, as I stated in many other meetings that we've had, and I figured it's just easier, we tattle on ourselves, situations in general. So for the month of October, we had 3 self-reports. One was family misappropriation. Missing money was out of the building. This resident was out of the building when that occurred, and then intentionally not following the care plan as noted as neglect. In November, we had 1 complaint, and it was a resident complaint of CARES. So these were all self-reported to the state of Wisconsin, and we worked through that process. We are working for the ALF is working with this new program. It's called Guide, and it's through CMS. Essentially what happens is it just gives them an opportunity to give them better resources for their family members. It's a new thing that's kind of rolling out just to kind of keep the ALF patients with dementia at their highest level of function, reduce the opportunities for rehospitalization, more benefits, 24/7 access to specialized support and care. And again, what we love about it is it's free of charge. So this is a system that is beneficial to our residents on the assisted living side of things. But it doesn't cost us anything to roll these things out. I actually have a meeting tomorrow with the Guide program through CMS to make sure that we're getting all the necessary things put into place so we can start utilizing them. As for that, we are rolling out ITSE, which is the International Dysphagia Diet. The end of January, beginning of February is the idea of when we'll officially have everything rolled out, but it is the new national standard, so we have to get with the program and change the way we do that. Question?
Are there any questions?
Yeah, I haven't heard anything about the water for a long time. What is the update on that?
We're clear, still no issues. We still send a sample out every month, and we have not had any issues since.
But no long-term as far as if we're gonna hook onto the city or new well?
No, and we can't really figure out the source, so we've kind of looked into everything. There's really no source of what we can find. They call it agricultural runoff.
But I mean, I guess what I was asking about, we talked about hooking on to the city water 5-6 months ago.
Yes, and we talked about that, and I think I brought it back up, and the decision was to just recoat the inside of things. So it would cost $4,000 versus $900,000 to switch. So we were just gonna have them come out and coat it and get it back.
Elaine?
Yeah, with this, new thing with dietary, is that something the hospital dietitian usually took care of? You know, the dysphagia diet thing?
Yeah, so our dietitian, she comes out Monday and Wednesdays, and then a speech therapist, we're all working together. So between me, Jossie, the dietitian, dietary manager, and the speech therapist, we're working on safely rolling that out. But all of our orders that come from the hospital are already the ITSE, so just trying to cross, but yes.
Nice, yeah. Yeah, I was curious about that.
I'd like to ask, the EMT service we had in the past, we're going to start trying to pay some of the fees on that. How much do you think extra a month? Now, so if someone is transferred from Pine Valley to the hospital and back, does Medicare, or Medicaid pay any of that?
So we can't be billed for anything that's billed to the insurance. The only thing that we can be billed for is for Medicare A patients. That is the only things that we can take on as a bill.
Those are private pay.
Private pay would pay their own.
They pay their own.
So they would get the bill, or they would bill their Part B or their Medicare, whatever they have. So even if they're private pay here, they still have an insurance that can technically be billed. So whether that be Medicare and a supplemental, that would be what is billed. But if Medicaid is billed or Medicare plus Medicaid is billed, we won't be billed for that. So the only thing would be billed for is Medicare A because it is an all-inclusive stay.
Okay, well, why did we have the townships paying?
See, that's to provide the service. So the billing part of it, we're just
Always
talking
been there?
about, this is just, yeah, that's always been there. This is just to provide the service so that it helps pay to keep the service running. Kind of like your light bill, you know, where you pay the service charge because they need to have money to make sure they got power lines. That's what that service is. So we'll have, there's gonna be a bill, we'll see it at the county level on how many calls, based on how many calls. They go
So
off.
everybody's gonna pay this next year $2,500.
Minimum.
Oh, so there, it's gonna run over and above for some townships then?
Yeah, oh, yeah. Depending on how many calls we
Per call is above. Oh, over and above, okay,
have. No,
all right.
The city of Richland Center is 156,000.
yeah, because it's the amount of calls they have. It's
Okay.
225
I've
calls.
been trying to digest all that, and I'm still kind of confused about it.
Yes,
so.
if you kind of look at it, it's just a service charge, like you pay REC
Okay,
or
yeah.
whoever else, that's what that is. And then depending on how many calls you had, if it didn't equal 2,500, then you paid a flat rate of 2,500 for the ambulance. But if you've got 50 calls, then you're gonna pay $225 a call.
Okay.
So that number's unknown right now, what that's gonna cost.
Correct. And like when I first started, there was a lot of unknown and kind of the change of conditions and things like that. So we kind of went top heavy with calling the ambulance for every change of condition for the guidance of our state surveyors. And then once we got people more confident in what those change of conditions meant and things like that, then we were able to kind of pull that back. So like if somebody has a boil under their eye, we're not gonna send them via ambulance, they go to urgent care. So it's really prioritizing and figuring out what truly means that ambulance service. And then obviously we utilize the state, our ARPA, Julie Brandt, quite a bit, when needing clarification of what is appropriate and what can we send via app.
Any other questions, Brittany?
Yeah, I just had a question, like, how are we doing with agency staff? It seems like we're getting more and more agency out there and not in-house. And I just want to say that we have to make sure that we're taking, I see we did the pay increase, which is a plus, but we have to get people here. And I know when I walk in there, I don't like the feel I get where people are afraid to communicate with me. And that's very uncomfortable, not only for them, but for myself. I want people to feel if they have a concern, they can bring it forward to us or myself or anybody, because that's what we're here for. And if people feel that they can't do that, then, that's not good, and that's not going to attract our employees from our area. And I just have noticed an increase in agency use lately. And I did get a call from a resident from Pine Valley, telling me some concerns. And I just want to put that out on the table, that we need to take care of who we have here, living here. Because those are the people that, we need to take care of in our community.
So one thing that I think is very important is that people are following the proper chain of command if they have concerns. So if they're coming to you with concerns and they're bypassing Jesse or Brittany or myself, because that's kind of the order, whoever their first level of support is, we can't fix the problems that are there. And that is one thing that I'm seeing is people are bypassing those people within the building who actually have the control. So if somebody comes to me and says, I have a concern, my first question is, have you talked with your direct supervisor? Have you talked with Brittany? So we have to be making sure, like if they're coming to you, that we're directing them back to the people in the building, because that's what they need to be doing. That's their job. And if they get through Brittany and they're saying, I'm still unhappy, then they need to come to me and say, I went through my proper channels. And this is all departments across the county. We really need to be making sure they're following that chain of command, because that's how we fix problems.
And see, where I have an issue is in this last issue that's recently been brought to my attention and all of us' attention, is the disciplinary process obviously wasn't followed, because never ever before do we go right from, having an issue to taking it to a county administrator and not having the in-house administrator handle it, because that's how it's always been in the past. And I did consult with Tom, and Tom said never ever has he had to involve an attorney or a county administrator. It has always been handled by him. And yeah, after the fact and after it's been dealt with, he would mention to Clint that an employee had been terminated or reprimanded, whatever, but it has never been handled such as it has this current issue that we're dealing with tonight or today. Yeah.
And I will say that I have worked with department heads on what is their comfort level. So if they want additional support, they feel they need additional support, they have the ability to come to myself and get that support and guidance. They have the ability to come with the attorney. And we do talk about, is this something that our internal attorney can handle? Do we reach out to John Anderson, the labor attorney, and have those discussions with them? Because we do want to make sure that we are handling HR issues appropriately.
Right. And I totally trust that you got the information you had and you dealt with it the way you felt appropriate with the information you were given. But I also feel that an employee that has been employed by the county for 23 years, we need to really look out, and I want to keep the longevity employees. I don't feel that, I just think we could have worked with this differently, is all I'm saying, and I just wanted to make that known, because it needs to be out there, because that's what I'm here for. So, thank you.
And I will say just to that, I have regulations and there are handbooks that I have to follow. And that was all presented the way it was because of the situation in general. So it wasn't that there was anything, and I'd be happy to have a discussion further. Because I know you mentioned closed session at one point. I'd be happy to kind of go into more detail about the situation and why it took a turn the way it did.
And we'll put that on next month's agenda, because I'm just saying, I worked there, I've had a history of no issues, really good, state evals and stuff, or state surveys, and now it's not there. And when somebody reports something, it's like, I want people, if they say something, or see something, to say something. That's what I want, and I want that to continue, but if this type of issue happens here, then nobody's gonna speak up when they see something wrong. And we're all gonna need Pine Valley in the future. And if somebody sees something, I want them to feel free to say it.
Correct.
And that's all I'm
remind
saying
everybody,
here.
There are two sides to every story.
Right,
So
there is
now
two
you've
sides,
only
and
got
I'm-
one
I
side.
know that.
Correct.
We're dealing with one right now in the legal system, so I get that. Yeah, thanks.
Any other questions or comments? If not, it's not on the agenda, but from here on out, we need to put like future agenda items.
Sorry about that. Future agenda items. you want me to add?
That
What
was
would you like
just
me to-
before adjournment.
Yeah, I think everybody needs to realize that the county board is probably the last step you should have to take. All this other stuff should come in before. We shouldn't be what, 1, 2, or 3. We should be 7, 8, or 9 down the line. Because otherwise, we don't all know everything about anything. We don't know the inside of anything, really.
Yeah.
So.
Did you want me to add anything for future agenda?
Just possibly, sometimes we may have to go into closed session. Anybody else have anything they would like to see on the agenda for next month?
2026.
Yeah,
Can we see turnover? So between all the staff, just kind of see what the turnover and see what the trend is on that.
Trish has already got that turnover.
Just so we should bring that up every month, just so that we see what's going on up or down. Kind of gives you an idea, especially when you're making a pay increase and stuff like that. Did it work? Or is it not enough? Or, you want to see what you're trending.
Absolutely.
It's a pretty high volatile workplace, I would say, in general. I mean, just because of the work itself, it'd be good to see where it kind of runs. Does it run at 25% or 50% or 10%? It makes a big difference to see how we're doing, because that we looked at all them numbers, and them numbers change pretty quick when we're using agency, because it's triple or whatever it is to the cost. So it'll give us an idea where budget wise where you're at.
Absolutely.
Good to know. We got to remember at the end of the day, that is the business of the county, and it needs to make money, right? Now that's not the only thing it needs to do, but that's what its intent is, to stay in business. So the rest of the stuff we talk about is tax levy, or it's this, or it's that, and we don't really have a lot of control over it. And we're not in it to it's not in it to make money, but this is. So it needs to be on the front end to everybody that, hey, this is no different than the business you run at home or wherever else. We need to make sure we're doing the right things. And just the more we can see, the better. Not that we're gonna, but it could show where, hey, we got a problem here, we need to work on this.
If I could ask a question too, for like the turnover on that. I know for the school board, what we do is every 2 weeks, we're posting vacancies. New hires, people that are leaving. So you could even see like the vacancies that are open that you're looking for people, or how many employees you're short.
Correct.
So if we could see the vacancies that are open.
Yeah, we do that every month, coffee, so we'll just bring that report moving forward.
That would.
So like
yeah.
coffee is usually the third Thursday, so you'll probably, as usual, be a month behind.
Yeah.
Now, in the past, it seemed like our hardest thing as far as turnover was other counties. Is that still kind of the situation?
I think we've gotten pretty close market value wise. Again, we're not gonna be competitive to the hospitals, we're not gonna be competitive to certain areas, but, you know,
So we're not losing as many to money anymore.
I mean, until the raises and everything go into effect, you know, there's always that possibility, but the reality of it is we have much better benefits. Whereas, you know, you pay $0 for a health insurance premium, whereas at the hospital, you're paying $800 to $1,000 a month in just insurance premiums, and that's not dental or vision, that's just health insurance. So, you know, we do have a leg up, but it's just getting people to understand those types of benefits compared to, you know, you're gonna make about the same amount of money by saving that
At
money.
the end of the day.
Correct.
The workforce isn't out there, the nursing staff, wise, that's a problem
Well,
too.
every place you look at, they're constantly trying to get people to work. So it's just across the board, and I don't know. And like you say, yeah, we've got the benefits for the county, but your younger generation doesn't understand that. They look at their paycheck,
Money right now.
money right now. And, until they get older or until it's educated, or they're educated better on that type of situation, about benefits, it's gonna always be that.
Changes in 26.
I mean, Alan Bradley's constantly looking, Terry's constantly looking, Shriver, everything, yeah. It's just across the board.
You just gotta get them over 26, and
Is that what it is?
then they gotta pay for their own insurance, so we gotta get them.
Yep, yep. So, any other questions or comments for Brittany or anything else tonight?
To adjourn.
We have a motion to adjourn. And you have a second. All those in favor, please say aye.
Aye.
All those opposed, you may stay if you wish.